in.
Alright, wash my hands. Hi, how are you today?
Very good.
Alrighty, awesome. So, my name is Victoria. I'm going to be your nurse. We're going to be doing a full head-to-toe assessment, checking all of your systems. During the assessment, I am going to be touching you various parts of your body. Is that okay?
Mm-hmm.
Alrighty, can I see your armband, please? Can you tell me your name and date of birth?
Gabriela Castillo, 10/20/92.
Alright, very good. And can you tell me what day it is?
June 16th, 2020.
Yep. And can you tell me where we are right now?
In the living room.
Yes, we are. Alright, so before we get started, can you please provide me with a urine sample?
Mm-hmm.
Thank you very much. Bathroom's right over there. While she's walking away, I'm assessing her gait. Everything looks even. She's not favoring one side. Alrighty, I'm putting on gloves. Got the urine sample. Thank you. So the urine is about 50 cc's. There's no redness to it. It's straw yellow. No sediment. Overall looking very normal. So I'm going to put this down and take off my gloves, do hand hygiene. Alright. So may I see your hands, please? Thank you very much. So we're assessing the integrity of the skin on the hands. The texture is dry and warm. There's no lesions, no bumps. Any tenderness while I touch your joints? No?
No.
Alrighty, and now we're going to assess the nails. They're not flaking, they're very thick, even. No contour, no spooning. So we're going to assess capillary refill in the fingertips. The fingers appear to refill within 2 seconds. Check this hand as well. Alright, we're going to test the hand strength. Can you squeeze my fingers? Alright, very good. The hands are strong bilaterally. And we're going to do a little range of motion on your wrists. So if you could just have them out and flat, you just face them up, and down again, bend them down, and bend them up. Fan your hands. Alright, very good. So now we're going to palpate up to the elbow. Is there any tenderness, any pain? Alright, there doesn't appear to be any swelling. No abrasions, no bumps. Alright, and we're going to do a little range of motion. Can you put your arms straight out? Bend those up. Bend them down. Alrighty. We're going to do a little strength, so bend them up again. Now I want you to pull against me. Okay? Alright, very good. So we're going to palpate up to the shoulder. Feel the ball and socket joints. Any tenderness? No. So for range of motion, can you lift one arm, put it behind your back, the other arm, put it below? Okay. Let's see. Yes, alright, can you switch sides with both arms? Very good. Alright. Relax. And we're going to test some strength. Can you pull up? Or push right up? Alright, very good. So now we're going to check the range of motion of the neck. Can you touch your chin to your chest? Alright, very good. Keep it there. I'm going to inspect the cervical vertebrae in the back. Alright, look up. Look up to the sky as far as you can. Alright. And while she's doing that, I can check for the thyroid gland. It's not enlarged. Alright, you can relax. So now we're going to palpate your scalp. We're just going to feel around, see if there's any bumps or dents, tenderness. Is there any pain at all?
No.
There's no areas of balding, no rashes, anything like that, no dents. Overall, very symmetrical on both sides. And we're going to palpate your ears. Let me know if there's any tenderness.
No.
No? areas do appear soft, no redness, no swelling. Okay. Now we're going to do a little whisper test. I'm going to cover one ear, whisper in the other. You let me know what you hear, okay?
ABC. 1, 2, 3.
Alright, very good. So now we're going to, can you move your glasses for me, please? Just going to feel around on the face. Again, for any bumps, dents, areas of tenderness. We're also going to be feeling the sinuses. So tender right there. Move right here.
No.
Feeling the temples. Are you feeling fine? Any tenderness?
No.
Move with the nose. Alright. Can you open your eyes for me? Look up. Okay. The sclera is wide and the conjunctiva is pink, which is normal. The eyebrows are symmetrical. Lashes are long. Alright. So we're going to assess for visual acuity. So we would usually do this with the smelling chart, and she would stand 20 feet away and read the smallest sense she could. But right now we're just gonna use my bag. Right, if I'm standing right here, can you tell me with your glasses on? What's the smallest writing you can read?
College or nursing.
Alright. Very good. Now with a pen light, I want you to look straight ahead. We're gonna check your pupillary light reflex, and we would usually dim the lights during this. So, look, one. Alright, constriction is about 3 millimeters. That is the same. We're going to do it one more time. So adjust your eyes. See if they come in. Alright. So the eyes are equally reactive to light, the pupil size is equal, and they are able to accommodate. So now I'm going to look at your nose. Just tilt your head up a little bit. We're just inspecting for any deviated septum, which looks good. Can you please open your mouth? Say ah. Stick your tongue out. Alright. Tonsils are a normal size. They're about a 1, not too big. Uvula is moving. The mouth is pink, wet, no abrasions. Alright, can you stick your tongue out for me? Like, Very good. Now open your mouth. Move your tongue side to side, up and down. Alright, very good. And I'm also going to palpate your jugulomastoid joint. Can you open your mouth as wide as you can? Alright, any pain? Alright, close your mouth. And clench your jaw shut. Alright, very good. And we don't feel any cracking, swelling, or crackles. So while I'm here, I'm going to palpate her preauricular lymph node. Here above the ear. Behind the ear, the posterior auricular lymph node. Down towards the neck. The occipital lymph node. The jugulomastoid lymph node. The submental lymph node. And the submandibular. Alright, there's no swelling. We're also going to go down to the superficial cervical. I'm going to go right here. See if we can feel anything in that deep cervical chain. And then in the back of the neck with the posterior cervical. And then down here with the subclavicular. Everything feels good. Now we are going to also check the maxillary, same as the lateral. have the subscapular. And then you would have the and then you would have the pectoral. And then the epitrochleum. Okay, and you would do that bilaterally on both sides. Alrighty, what else? Eyes, ears, head. Alright, now we're gonna move on. And we're gonna listen to your breath sounds. And I'll wipe the stethoscope. So, when I tell you to take a deep breath, you're going to breathe in through your nose and out through your mouth. Breathe in. Good. That's the bronchial area. Very good. Now we're going to go to the vesicular. Under your shirt, something here. And then the bronchiovesicular. Okay. Alright. Let's sound clear. I'm gonna do the same to the back. I'm gonna go under your shirt, okay? So, take a deep breath. Very good. Again. Very good. Again. Okay. Okay. One more time. Very good. And we're also going to auscultate for bronchophony sounds. So you're going to say 99. Go ahead.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
And again.
99.
Alright. And we're going to go through it again. This time I want you to say E, E, E.
E, E, E.
Good. Again.
E, E, E.
Good. Again.
E, E, E.
Again.
E, E, E.
Again.
E, E, E.
And one more time.
E, E, E.
Alright. I'm going to do it one more time. This time I want you to say 1, 2, 3.
1, 2, 3.
Again.
1, 2, 3.
Again.
1, 2, 3.
Again.
1, 2, 3.
Again.
1, 2, 3.
And one more time.
1, 2, 3.
Very good. So that was assessing the egophony with the E, 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 and the pectoraliquy with the 1, 2, 3. So now we're going to feel for tactile firmitus. So again, if you will say 99.
99.
Good. One more time.
99.
Again, one more time.
99.
Good. One more time.
99.
Alright, very good. So when auscultating her vocal sounds in the back, they were muffled, which is what you expect to hear. If they were clear, they would indicate the presence of fluid, and her tactile firmitus. It is a strong vibration, but I could not feel the 99, so that's also a normal finding. So now we're going to auscultate her apical pulse of her heart. So you go mid-clavicular and then down to about the fourth intercostal. I'm trying to think of them on the right side. I'm sorry. Okay. So the heartbeats are steady and regular. There's no signs of murmurs, no irregularity in the heartbeat. So we're going to go over. We're going to feel from the sternal notch. I'm going to go down to the angle of Louis, and then to the right, and that's where we can hear our aortic sound. So I'm going to go through the top of your shirt here. Very good. We're going to go to the other side and hear the pulmonic area. Very good. We're going to go down just a little bit to the Erb's point. You hear both sounds would be equally loud, the S1 and the S2. Very good. And then we go down to the tricuspid area. We go down from the bottom. And it's going to be about the fifth intercostal space. Oh, I hear your sound. Very good. And then we're going to stay here. We're going to go sideways to about mid-clavicle for the mitral area. Alright. So S1 and S2 sounds. Good. There's no splitting. There's no S3 or S4 sounds that can be indicated or heard. So now we're going to check the pulses down the body. So we're going to go to the carotid. Side. We're going to go down to the brachial. Alright, go down to the radial, right here on the thumb. And the ulnar on the pinky side of this. Alright, and the popliteal behind the knee. And the dorsal pedis. You would also do the femoral artery, which is in the groin area, and you can also feel the inguinal lymph nodes there as well. Alright. Everything feels equal, strength bilaterally in the pulse. And we're going to palpate the legs.
Your laptop.
No.
Look, is it still recording?
Yes, it is. any swelling, any pitting edema. You can see there's blanching, but the color comes right back. I'm going to palpate the knee, see if there's any squishing. Is there any pain?
Mm-mm.
Alright. Do it here. Can you press up against my hands? Very good. Can you pull back with your legs? Very good. With your ankles, can you bend them inward? Very good. Can you do it outward? Very good. Can you flex them up? Very good. And point them. Awesome. And now try to pull it back. Can you press down on your hands? Can you press up? Okay. Good job. And we're going to check the capillary refill on the toes like we did on the fingers for that peripheral circulation. Alright, it looks good. Still in that 2-second range. Alright, very good. So if you could please lay down this way, we're going to be listening to your abdominal sounds. And if you could please expose your stomach a little. So we're going to be auscultating the 4 quadrants of the stomach. So we have the right upper quadrant, and we should be able to hear vowel sounds in all of them. Alright, go to the right upper quadrant. Left upper quadrant. The left lower quadrant. And then the right lower quadrant. Very good. And before we auscultate, we would also inspect, see if there's any bulging, and now, or discoloration. Now we're going to palpate in different areas. So let me know if there's any tenderness. There's no bulging of the organs. This palate. Almost done. Alright, you can sit up. And can you stand for me, please? So, can you hike your shirt up a little bit and then touch your toes? Thank you. So we're going to be inspecting the spinal column, seeing that it's straight, that there's no bulging or swelling. Everything looks aligned. Alright, now come up slowly. 1, 2, 3, 4, 5. Alrighty, and it kept its alignment. So, can you kick your legs straight out for me, one side at a time? Alright, just straight up. Oh. Alright, very good. Next one. Very good. That's assessing the range of motion for the hips. This side. And can you kick your legs straight back? Good. Excellent. Very good. And now we're going to do the Romberg test, a test for balance. Can you close your eyes? Okay, feet together. Right. Very good. The patient is able to steady herself even when I apply a slight pressure to the back or the front. Alright, and relax. What else do we need to say? Oh yeah, we're going to do the abduction of the hip, so lift it straight to the side and back. That's adduction, opposite side as well. Very good. And can you swing your arms back and forth like this? Alright. Looking at the hyperextension in the shoulders. Very good. Can relax. Did I have you look side to side? Can you turn your head side to side like this? For the range of motion of the neck. Very good. Okay. Let me see what else. can you have a seat? We're going to talk about some reproductive health. Just going to do a quick interview. When was your last menstrual cycle?
Last week.
Last week? Alright. And about how many days?
7 days.
7 days? Alright. So, do you have breast examinations or mammograms often?
No.
No? Alright, so that's fine. You should go. It's really more prominent when you're a little older in age. So you're 27?
Mhm.
Yes. So you're right about, I would start at around 30. Just scheduling them regularly, at least 2 or 3 a year. And then as you get older, you would want to schedule a little more. But what you can do at home, you just want to, on the 4th through the 7th day of your menstrual cycle, you want to look at a mirror and see if there's any like dimpling, where the skin is pulled in on the breast. You want to look out for any of that. You want to feel for any lumps. And how you would do that, you would lift your arm like this, and then you would walk and feel up and down the breast, all the way across. Make sure you feel every inch of it. You can also work in, out, or out, in. And then you're also going to want to inspect the nipple. You're going to want to squeeze it, see if there's any discharge, blood. And then while you're doing that, you also want to feel these lymph nodes that I mentioned before. See if there's any swelling or pain. Or just any masses. If you do find one, you want to call your provider just so they can see if they need to do biopsy. Also in the shower, that's the best place to do it. Just because, you know, you're already naked, you're already aware of your body. Yes, that's pretty much it. Is there anything else I can do for you?
No.
Alright. Would you like the door open or closed?
Close, please.
Closed? Alrighty. I'm gonna, if you're in a hospital bed, I put the bed down, I put the handrails up, and she wants the door closed. And the call light is right here. If you need anything, don't hesitate to call us. And that is the head to toe assessment.